Hello and welcome back to another episode of Senior Spot. I'm really pleased to have here today as a guest Karen Riley, who is the Director of Nursing at Westford House right here in Westford. So welcome, Karen.
Thank you, Jen. It's nice to be here.
Great. So, Westford House, I've lived in Westford for, it'll be 18 years this summer. And until I came into, this type of profession and industry, I didn't know where Westford House was. And Westford, as we know, is pretty big in terms of land size. So tell us exactly where Westford House is located.
So it's right off of 110. It's on Park Drive. It's right near the Market Basket Plaza, just past it on the left. And it's buried back in the woods, so it's a beautiful setting.
Okay, all right. So I guess we need to go and roll back a little. What is Westford House? What exactly is it? And I know that it's part of a bigger company. So explain a little bit about, the parent company and then how unique and individual Westford House is.
Okay, so Westford House is part of Genesis, which is a huge company. It's in, I think last count was about 32 states, and in China and Canada and other countries as well.
Okay.
But Westford House, I believe it's the only skilled nursing facility in Westford.
Yes, I can say yes, that is true.
Yes. It has 3 units. It has a dementia unit, which is secured. It has a long-term unit, and it also has a rehab unit, which is subacute, where the people who have had a hospital stay will come to recuperate before they go home.
Okay, so your role is Director of Nursing. So what does that entail? What is your day like, and what are the things that you're doing there?
So I go in with a plan, and then it's whatever happens during the day. So
that's life, isn't it?
It can be anything from actually working as a nursing assistant to scheduling nurses for the shifts.
Sure. So obviously the priority and everything is on the wellness and the safety and
absolutely.
The outcome.
It's sometimes hard to remember that we are there for one thing, and that's to take care of the people.
Absolutely. So
yes.
I know that there's multiple levels of care, like you mentioned. So you have but a lot of people, when you say Westford House, it is their home.
It is their home.
So you
very
have,
much like a home too.
And the times that I've been there, sometimes I'll bump into the same folks that are residents there, and they're very happy, and everyone's always engaging, with them. And so Westford House is a good name because it's their home. So that's, those are some of the long-term residents that you have. So can you tell us about the different levels of care and, the types of stays that people might have?
So, it starts out, they can come in for rehab, and it's usually in from the hospital, and they either recuperate and go home, or they'll transition to long-term care.
Okay.
We do have a lot of people, the goal is always to go home, but they're not always able to. They may have reached a point in their life where they're not able to, have the families these days are working all the time.
Mm.
It's not like in the old days where there would be somebody home to take care of the older people.
Sure.
So, they'll stay, and it becomes their home. It is a home.
Yeah, that's why, I like the name of it, because that's what it is.
It is, and it's very homey in there. There's lots of different rooms. There's a reading room, a TV room, a game room. Everybody's engaged, and there's a lot of laughter in the building.
Good.
It's sad in the beginning. The transition is hard sometimes for them, and sometimes they're very accepting and happy about being there because they were so isolated at home.
Or they're just tired of their family, living with their family. So that can happen too.
Yeah.
Let's just be realistic.
It can be overwhelming. It can be overwhelming for the families, I think, more than it can sometimes for the residents themselves.
Absolutely.
It's that guilt that
Right.
that they never wanted to have to place somebody in a facility, and we have such a stigma attached to it.
So tell me a little bit about that, because it's true, and I think.
And you see ads on TV now. Was your family member hurt at a nursing home? Please call us.
Right.
And it's so demoralizing, not only for the residents in the families, but for the staff, because
Sure.
we really care about our people.
Yeah.
You know, we spend more time with them than we do with our own families.
This is true.
You know, so you build bonds with them.
Sure. And you know, and nursing home isn't even really an expression or a way that people are referring to it anymore, because it's so different, you know, than what you know, a traditional nursing home that people think it is. There's so much more going on that's you know, that's enriching to someone's life, but also just making sure that there's all sorts of needs that are being met that might not be met at home. But I like that you point out the isolation piece, because that's a big issue, you know, that can weigh down on somebody mentally.
Right, and it's not only isolating for the residents themselves or the patients that come in, but for the family members as well. The family members that have been taking care of them at home, and are so guilt-ridden because they've lost the ability to do it.
Yeah.
You know, it becomes a 24/7
Right.
caregiver role, and there's no break for them. So now when they transition to us, the family gets to spend more quality time with them, and they don't have to do that hands-on care.
Right.
They still can, and we involve the families. We take care of the families as well as the
Sure.
patients a lot of the time.
Yeah.
You know, we offer them support just right along with the residents that move in.
So it can end up being a gift to everyone.
It
It's just
is.
one of those hurdles that's hard for people to get over, and you and the rest of the staff definitely makes it that much easier to feel welcome. And,
Harder
and
for
to do
some
that.
than others.
Sure,
Yeah.
absolutely.
So.
So I mean, that's, you know, going along with the word Westford House and it being their home, being their long term. But you also have short-term stays, you know, just like you said, for rehab. But
We do.
and people go in there under kind of like almost like 3 different levels. It could be planned, so maybe you can talk a little bit about planned, you know, if someone knew that they were having a hip replacement, knew they would have to go to rehab. And then there's also emergency, of course.
Yes.
And then there's also a respite if someone needs to come for a short term. So maybe you could talk about
Yes,
each
I
one of
don't
those.
think people understand that there are, you know, facilities like mine do offer a break to a family who doesn't want to place their family member if it's not quite the time yet for them to do that. And they have a family vacation planned and mom or dad's, you know, not up to going with them. They can come stay with us for a week or two or even a few days.
It's great peace
For a
of
weekend.
mind. I mean,
It is
to
a great
really
peace
go
of
and
mind.
and to relax and enjoy yourself.
Yes.
And you know, sometimes I'm sure you have the family members that say, "Oh, well, I guess you're just going to drop me off," and the minute the family goes out the door, they're
You
having
know
a
what?
good time.
It reminds me so much of way back when my kids were small. I did daycare at home.
Okay.
And it's so much like that. You know, you drop them off and they're crying at the door, but the minute you leave, they're having a great time.
Yes.
You know,
Yeah.
and we, you know, we'll focus on them.
Sure.
And with the new patients that come in, sometimes it takes them a little bit of time to get acclimated, and before you know it, they've made friends, and you know, there's little cliques in there with the women, and we have more men than I've ever seen
Really?
before.
I
Yes.
wonder
It-
why.
It used to be probably 70–80% women.
Right.
I'd say it's about 60–40 now, with men
Interesting.
and women. We also have 5 married couples.
You know, I'm so glad that you brought
5
that up,
married couples
because
in there that
I
stay
know
with us.
recently you had like I don't know if it was a sweetheart dance or it was a renewal
No,
of vows.
we did.
Right?
We renewed vows
So tell me
on
about that.
Valentine's Day. So we were in morning meeting and we thought, what can we do, you know, for the residents for Valentine's Day, something special, and we thought that, you know, well, we have 5 married couples living together in the facility, and we thought, why don't we have, you know, the priest come in and we'll
Right.
renew the vows and we'll have a ceremony and flowers, and it was just so beautiful, and they were so excited. We had one gentleman who lives with his wife. She's got dementia and lives on the dementia floor, and he won't leave her side. So he had a doctor's appointment that morning, which would have meant that he wouldn't be able to make it. So we called the doctor, and the doctor was so great, let him come a half hour later, and he came, and he had tears in his eyes. He
Oh.
was just so happy about it.
I think I was
You know,
there.
it was
I think
so
I was
nice.
actually visiting with another staff member the next day. It was the next day, and one of the gentlemen was in the entrance. He still had the boutonniere on from the day before.
Oh.
He kept it on. It was like on suspenders or whatnot. So he was so happy and so proud.
They
to
were
have that.
so. I think the men more than the women were. I mean, we're just so
well, they didn't have to pay for it this
sentimental
time.
about the whole thing. Yeah.
Right.
Wasn't it the bride's parents
Yeah,
that
that's
paid
true,
for the
that's true.
wedding?
I guess
Yeah,
I forget because
so.
we paid for ours, so I forget.
Paid for mine too.
So that's where you have, you're mentioning that, those are just special events that you have, and anybody can be
you have to
involved
look
in
at
those.
it in that setting within the facility with the long-term patients. That is their home,
Right.
And it's what they want or what their needs are, and we make it as good as it can possibly be,
Sure.
with the means that we have.
Absolutely.
Yeah.
And then you have people that just stay with you for short term.
For the short term.
And some people have a plan. So let's say, a hip surgery.
Right.
And I'm always encouraging people to be proactive. If you know you're going to have something, it's always good to do your homework ahead of time, make sure that you know. And unfortunately, I've come across a number of our clients where they haven't been necessarily forewarned or prepared about the fact that they might actually have that interim step between the hospital and going home.
Right.
And so, we usually raise their awareness and say, well, it'd be great for you to plan for this and to plan on maybe looking at a few places, because when the time happens, you don't know if there's availability or not. So for planned purposes, how does that work at Westford House?
Healthcare is such a complicated issue these days. So somebody would go into the hospital and have it planned. However, if they chose that they were going to come to us, and the family would come and tour
Right.
and pick it out, sometimes they'll bring the person who is going to be staying with us.
That's what I'm thinking
so that
is
they
ideal.
can, take a look and see if that's the place they want to go.
Sure.
And then they would let the case manager at the hospital know that this is their choice.
Okay.
Things have changed so much in healthcare these days that people aren't staying as long in the
Right.
hospital, that a facility like ours is more like what the hospital used to be.
Right.
The post-surgery,
Yep.
the cancer patients that are trying to get a little bit stronger so they can have chemotherapy.
Right.
The wound patients at home who can't seem to get that wound healed will come in. We're very proactive with that. We've had great successes with wounds.
Yeah, I know that different places have different specialties or, a number of things and areas that they really focus and excel at. So wound care is one of the things I know we've talked about.
We get a lot of the COPD patients that have
Interesting.
had an exacerbation, or they have pneumonia, and they'll come in and they'll recuperate and get stronger and go home.
Okay.
We've had some flu patients that, in the elderly, you get the flu
And it just
just
quickly
wipes you out, and you lose it a lot faster than you gain it. So they'll come in, and we recently had one gentleman in his 90s, had the flu. He recuperated. He went home, and he ended up with a urinary tract infection. And he was just so wiped out by the time he came back.
Mm-hmm.
But he had been living by himself and doing everything.
Right.
And, there was a little bit of time there where we thought that he may end up having to stay with us long term. But he's leaving Monday.
Okay.
you
That's
know?
a
And,
great success story.
That's always our goal.
Right.
If that's what they want, then we try everything that we possibly can, and the whole team works together.
Right. And it's not a one size fits all. So
No,
every
each case is
person's
different.
Needs are different.
And, that's another thing. We get a variety of things. We get so many different types of cases and illnesses and,
That's why you go in
surgeries
and there's
and-
not a plan. You go in and
right. There's never, I have my chores that I need to do
Sure.
every day, but, some days I never get near them, and
Right.
I'm with the patients all day.
Yep, and being in charge
So,
and overseeing all the
yes.
different
I'm just
levels
one
of
of the
care.
team, though,
Yep.
so it's, and we have such a wonderful team in that
So,
building.
so tell me a little bit more about that, Karen, about when you mentioned the team and there's longevity there. I know that you've shared
There
with
is
me.
longevity, which, is so refreshing to see, because there's such a turnover in this business. Nurses get burnt out, all the caregivers get burnt out,
Sure.
and they try some different aspect of nursing or go to a different facility where they think it may be a little bit easier or different. We have staff members that have been there for 20 and 30 years.
That
you
says
know,
a lot.
across the board. It's wonderful. It's a great company to work for. It really is. They're, you know, family oriented. They know that the staff has a life outside of the building, and we take care of each other as well
sure.
as the patients.
Right, because
So
it's 24 hours. Someone's
it is,
always in
and
charge.
you know, it can be very, very stressful.
Yep.
It can be very stressful.
But you look out for each other as well.
We do.
And make sure
you
that
know,
everyone's
we really
covered.
appreciate, you know, everybody's hard work when they come in.
Yeah.
So,
Well,
it's
and you know, one of the big needs, of course, now in the community is, you know, having excellent dementia care, and something that, as you know, my company really prides itself on making sure that we are giving the very best support that we can. And so you mentioned in the beginning that we have short-term, long-term, respite, which is the short stays if someone needed to stay for a short bit. But then part of your long-term, you know, residents are also in your dementia unit. So tell me a little bit about that.
you know, that's one of the saddest things, because a lot of times with the dementia patients physically, they're really strong. You know, they're still able to do so much.
I know.
But it can get to a point where the dementia is so overwhelming that you can't trust them even to close your eyes for a minute. Everything has to be structured for them, which is what our program does.
Which is so helpful.
And
that
you know,
structure.
it's the repetition that gives them comfort, that makes them feel so secure
and safe.
And safe, and that's the biggest thing when they first come in. You know, they can have a lot of behaviors because they're scared.
Yeah, and any changes that are new are just so
anything that's new, it just throws them off.
Right.
And can you imagine waking up every day and not remembering?
No.
You know, whether it's your short-term memory is the first to go with dementia, and you can't remember 15 minutes ago what happened or where you are, but you have the same caregivers every day.
Right.
You know, we have a very dedicated staff up there that just love
well,
those
and of
residents.
any place in the building, that's where you do need the most
You
consistency.
do, and it's a structured program. They have activities all day long. You know. I think that's one of my biggest concerns about the dementia population right now, is that there isn't enough understanding.
Oh, I'm on board with you there. You know, that's a big mission of mine.
With family members that have to deal with this, and the guilt of knowing that you're overwhelmed and you can no longer take care of them at home, and then having to place them in a facility.
Right. Big decisions.
Yes, big decisions.
So you're, as a director of nursing, you're overseeing all of these different areas.
I am, and I do a lot of, you know, talking with the families as well, because they have so much guilt when they place their loved ones. I've seen a lot this year with them keeping them home so long that it gets to a point where the transition is so much more difficult for them.
Yeah, there's a right time and a right
There
place
is,
for each thing.
And they can become very physical once they get past that point, especially when you try to place them. You know, even though they're physically strong, their mind is not their own. They're not in control of their actions, and
it can be dangerous.
It can be very dangerous for
family
them.
members, for themselves.
I see that they transition much better if you don't get them to the point, keep them home to the point where they are just physical and combative, and
it's not good for anyone.
It's not.
And that's the, you know, and families think they're doing the right thing by doing so, because they don't see the big picture. So having someone like yourself be able to educate them, that's really important.
Right. You know, I do this all the time, so I know. They don't know. The families don't know what's coming down the line.
Want to know.
And it doesn't always happen. You know, they don't all become that way, but a lot of them do. I see the ones that are kept home the longest are the ones that have the most difficulty transitioning into, you know, a dementia unit or, you know.
But see, that's I think another unique feature that at Westford House, where you have folks that might be long-term, and a lot of times at a certain age, there's maybe a bit of dementia, you know, is pretty common. in each person. So
it is, and we have a little bit of dementia on every unit.
Exactly.
We do, at
Right.
all different levels. And,
Right.
you know, there's forgetfulness, which
age-related forgetfulness, that's
absolutely
just normal. But
you
they're
know,
able to transition within
they
Westford
are.
House,
Yes.
which is, you know, so if someone
are.
really did need to have that oversight where you were concerned that there might be a wander risk, that's already been their home, so that they're able to transition
Yes.
into a unit that is secure, that is able to make sure that, you know, there's no wandering.
We always try to place the residents on the unit that is going to do them the most good.
Right.
And sometimes that's difficult for family members to adjust to.
Sure.
I have a resident right now that really needs to go on the dementia floor, and she just came to us about 2 months ago, 3 months ago, and the daughter is having such a difficult time. So when the daughter comes in, and I see this a lot, I got to say it's much more so with mothers and daughters.
Interesting.
So much more that the mother's fine, the daughter comes in, the daughter is anxious. Mom gets anxious.
Oh, I mean, that's classic of
It
the
absolutely
unraveling,
is.
you know,
Yes.
and that someone with dementia is a sponge, and we call it check yourself.
Yeah.
Check yourself at the door. All of the emotions, anything negative, anything anxious, any of those types of behaviors need to be checked at the door,
Yes.
because
But
you're just going to mirror.
I also see sometimes mothers throw guilt at their daughters.
Oh, really?
Yes.
Go figure. Go figure.
So they have a different perception of what's actually going on when
Right.
they're not there. So it's you know, it's people.
Yep.
It's people, and they're all different, and it's never dull.
But what's great is that wherever they are in the building, you know, even if they are going to be transitioned, you're able to meet those needs.
Yes.
So everyone has the oversight and the training, and to be able to make sure
Yes.
everyone's safe.
And we do it as a team. We do it as a team. We discuss it. We, you know, throw ideas around and what's going to be the best way to care for these people. So, yeah, it's always.
So you mentioned, you know, some different stories like this woman and her daughter. Do you have any, you know, success stories or unique stories that would be helpful for, you know, the community in Westford or in the community just around Westford to know that, you know, that has made, you know, that makes your location, Westford House, unique? You know, anything that sticks out to you that you
Well,
could
I
say,
don't know.
huh.
I think it's our wound care. You know, we have residents that have been trying to heal their wounds at home for a couple of years, and they come in, and I have a great wound team, and we get them healed, and they move on.
Now,
So-
why do you think it's difficult for someone to take care of that at home on their own?
I think they don't understand the whole multidisciplinary team that needs to go into it.
Okay, so tell me like what
with
that would
wounds,
involve.
With wounds, it's all about circulation and nutrition. So if mom's at home and there's no social interaction and they're isolated, they're sitting all day, and they end up with a wound on their bottom because they've been sitting.
Sure.
And they're not eating a very good diet. They're not getting enough protein. They're not drinking enough water. They get a wound, and it takes constant vigilance, and we'll get the dietitian involved, we'll get rehab involved to have them start moving more and start being able to move more and strengthening them. And then we have the wound team doing the dressings and caring for them, and sometimes we'll change what the dressing is every other day.
Right. So
You
I mean,
know,
that
as the wound
multidisciplinary team
yes,
is
it's
really what,
very important.
because you know, that being someone who is non-medical, you know, you wouldn't realize that nutrition, you know, played into it. I mean,
Right.
when you step back and you think about it, okay, that's logical, that makes sense, but you wouldn't think that, you know, this portion would significantly impact, you know, a wound and its healing.
Absolutely.
You know, so I mean, that's why we have professionals like yourself in the jobs that you're in, because you know, the rest of us that might specialize in other things, we wouldn't know that.
You know, it's another really nice thing too. We have a medical director who has a great team of nurse practitioners.
Oh, interesting.
So the nurse practitioner is in there just about every day.
So
She's
they
in there
actually come
about
into the
5 days
building?
a week. She's
Okay.
there all day long. So and the medical director is in once or twice a week, but you know, the nurse practitioner is right there working with the nurses, working with our team. So whatever we need, we can get.
Oh, that's great.
So, you know, with the orders and the assessments and
Sure. See, I wouldn't have even, I would never have known that.
yeah,
That was a
and you
whole
know,
nother layer.
there's so much we can do now within the facility
Right.
to prevent them from having to go back to the hospital.
Right. Well, and
You
that's our
know,
whole goal. I
and
mean,
that
all of
is-
us are on the same page
That
with,
is the whole goal.
you know, reducing readmissions, making sure people are not ending up back in the hospital, you know,
Right,
making
because
sure.
it becomes a vicious cycle.
That's the
you
word.
know? It's because the care at the hospital is done one way, and in my facility it's done in another way. In the hospital, they go in to take care of a specific problem that they're having at that moment. At my facility, we're taking care of the whole
Right. So you have big picture.
big picture.
Right.
And how are they going to do at home? You know, how is the family going to be able to do this at home?
And just being sometimes put into a different location, even temporarily, going into
Right.
the hospital is very traumatic, and it really sets people back
It
quite a bit.
does. It does, because you know, in the hospitals they're challenged as well.
Oh,
There's
sure.
they can only do what they can do, and they get them past that acute stage.
Right.
You
So we
know?
all, it's like a tag team, like a
It
relay.
absolutely is.
It's a
And then you know, there's that continuation of care when they get home,
Right.
and there are so many resources for that
Right.
that they're not aware of.
Yes.
So
Well, this is the mission of the show.
this is true.
is to make sure that people know
This is
that
true.
we have these resources right in our
Yes.
own community or close by, and that the resources all know one another too.
They
so
do.
it just takes a moment to even ask, well, if this should happen, or like in my own business where we know if somebody's going in for a planned surgery or they ended up in the hospital, well, you do realize that rehab might be your next step, or that you're going to need to have a, you know, visiting nurses agency come in. People don't realize that, but we do. So we can help, you know, making sure.
Right, and how it's supposed to work, or the goal of how it's supposed to work now, is that you have the hospital and we have a connection with the hospital. And then we also have a connection with the home care agencies.
Right.
And that home care agency should be able to reach back to us if we transition somebody home.
Right.
And they're not doing well, they can come back to us.
You bet.
Before they have to go back to the hospital if they went home a little bit too early.
Right.
Or they're not able to manage at home like they thought they were going to. They can come right back to us.
Exactly. And I think that's really important for the community to know that everyone's in this together to make sure that people are where they need to be and doing what they can do.
And I think, you know, all of us, all the hospital, the home care agencies, my facility,
Right.
the doctor's offices are all working very hard to keep those lines of communication open for each and every resident or patient that comes into, you know, into my facility or
Right. No, we are.
transitions
We're
home
working
with
hard.
you. Yes, we're working very
we're
hard.
lucky to all have one another,
Yes.
and Westford's certainly lucky to have Westford House. So very happy. Thank you, Karen, for coming on the show representing Westford
it's been my
House.
pleasure.
And you'll have to go and check them out for yourself.
I will.
Right off of 110.
Come see us.